just,
Yes.
do you hear me correctly, right? I'm trying to change my mic setup. If I can remove these and speak freely to the phone, just give me a second.
Sure, but I can hear you very clear. No problem.
Do you hear me now?
Yeah, I can hear you well.
Okay, that's good. And there is no echo. It's better like this. I can speak freely. I've been all day on this.
Yeah. Can we start?
Yes, sure.
Sure. Yes. The first question is, can you please highlight some of the most significant numbers from the UNAIDS recently published report on the HIV endemic among young people from Asia Pacific regions?
Okay, thank you for this question. And this report is done by UNAIDS in collaboration with a number of partners, including youth organization called Youth Lead, but also with other UN agencies. The report attempts to highlight some of the latest updates information with regard to how young populations, young people are affected by the HIV epidemic in this region. Very notable figure to announce or to refer to is 26% of all new infections that are happening in Asia and the Pacific region are happening among young people. Now, 26% might appear relatively small, but when we compare this 26% to the proportion of young people in Asia and Pacific among all the population, which represents roughly around 17% of the total population, you can see the inequality there, or the disproportionality. 17% of the population is contributing 26% of all new infections of HIV. And that's really important to highlight that we have a matter that needs to be considered with high priority and attract the relevant focus and attention from managers, policymakers, donors, and implementers in this region. Specifically, when we look at different specific countries, we see the situation is rather more challenging when populations, when some countries have like 18 or 20% of their total population are young, aged between 15 and 24, but that contributes to almost half, 50% or 40 or 45% of all reported new infections. And that highlights the further vulnerabilities of these populations. One of the major issues that this report brings out is that it's not only an issue of numbers and epidemic, it's lived experiences of how young people are facing inequalities and difficulties in accessing HIV-related services, including prevention. And there are several reasons. You start with stigma and discrimination that is felt by these people when they go to health services, particularly for HIV-related testing or STIs, for instance. But also you add to this other complications. Some of them are of policy nature, particularly with regard to restrictions in age of consent to access HIV testing, or of service delivery models, appropriateness. And we all know that we do not have much young people friendly services that are open and available in, to cater and provide services for young people according to their needs and the nature of their lifestyle. So it's a complex set of issues which this report tried to bring out, but also it highlights the importance of having community leadership, particularly from young people organizations who have managed to establish good interventions that have proven to be effective and leading to tangible results. And also how they are engaged in advocacy and in shaping up the response, particularly on how young populations are being affected to HIV. So in a nutshell, that's what the report talks about.
Can you elaborate more about why are we seeing an increasing number of HIV infections among young people, especially age 15 and 24?
So first of all, I'd like to clarify it's not an increasing number. It is, in reality, the number overall in the region is decreasing, but that combines all countries. We have few countries where this number is effectively increasing, and that goes in line with the overall trend of the epidemic. However, the main point is to say we might be having an increase in proportion of infections among young people as compared to the infections among the new infections among the general population. And that's particularly in a number of countries, the focus is not specifically designed to respond to the needs of young key populations, as I had just mentioned. And this is an important element that creates that inconsistency and inequality of how we can respond to the epidemic and have an impact on the observed trends. So this is an important element that needs to be factored in the design of service delivery, in policies, in financing, in all aspects of responding to the HIV epidemic and addressing specifically the needs of young key populations. And young people, particularly in general, are facing a number of challenges. And I would just use the opportunity to repeat them, particularly with regard to the lack of accessible and youth-friendly health services, and particularly HIV-related services. We have an issue of comprehensive knowledge. It starts with that. I mean, when we look at the overall knowledge of HIV, comprehensive knowledge of HIV by key populations is in general low. And at best of cases, it does not go beyond 50% in a number of countries. Usually it remains low. So when you have young people not accessing information, not accessing services, and also facing vulnerabilities that lead them to a certain number of behaviors where that they cannot protect themselves from the risk of infections. You add this to the existing stigma, discrimination, and policies that limit their access to service delivery. That's what is leading to this observation that the control in most countries, or at least in an average, as we see for the region, we do not have that good trend that we are expecting that would lead us to the control of HIV epidemic among young people.
Yes, I'd like to know more about who are the highest risk group,
Right.
and what are the main transmission HIV sources that are affecting the young people in the region. So
we have done with countries and with partners, we have done a good analysis based on a wide range of evidence and modeling tools and in contributions of experts, including from countries. We find that while we have a large proportion of all the infections that are happening, I mean, those 26% of all new infections among young people are mostly among young key populations and partners. And young key populations here, I mean, men who have sex with men, sex workers and their partners, and injector and drug users and their partners and sexual partners. 99% of all infections among youth are within these populations and their sexual partners. So it clearly indicates the type of vulnerabilities and risk of transmission. We should highlight the large proportion of infections that are due to male sex, which represents a larger proportion, particularly in this region, and requires that the response specifically addresses solutions to reach those populations. In addition to reaching the larger youth population with the relevant knowledge and facilitating access for services, but the fact that we have a majority, 99% of all youth infections are among these key populations. It gives us how we can be extremely impactful by targeting the right populations and understanding their needs and also their risks and their behaviors and their requirements so that they can protect themselves from being infected.
I see. Thank you. Stigma against HIV, people living with HIV is prolonged problems when dealing with this endemic. Do you have any ideas or what are some innovative engagement strategies to reduce others' discrimination against people living with HIV? Can you suggest one or two?
Yeah, there are many. And it's good to have a comprehensive approach to stigma and discrimination overall, but by looking at the different settings on where the stigma and discrimination is being observed and how. Community settings, education settings, health system settings, justice settings, also in situations of humanitarian and emergency settings. All these elements require some form of adaptation of how we can address stigma and discrimination to be more effective in, leading to elimination of stigma and discrimination. Now, a lot of work has been done in this region, and I'm pleased to highlight the great work also being done in Vietnam with this regard, in collaboration with some regional initiatives in ASEAN countries and strong collaboration, particularly towards reducing stigma and discrimination among key populations against PHIV in health sector settings, for example. And there are a number of models. It requires an approach of capacity building. It requires an approach of bringing stronger partnership and engagement of community organizations to explain the challenges, to find the solutions, and to establish monitoring systems and mechanisms on stigma, on perceived stigma, on real stigma, and all these things, and establish systems to act on it and respond. So at UNAIDS, we have facilitated regional consultations with a range of stakeholders with regard to stigma and discrimination in each of those settings. And it's really interesting to see the strong willingness and partnership and engagement by governments, by community organizations and civil society, but also the leads of those relevant sectors. It's a well-recognized problem. The attention to scaling up the solutions is growing. We see that growing over the recent years, although we're not yet at the scale that would lead us to claiming that we are eliminating stigma and discrimination against people living with HIV and against key populations, because that brings additional layers of stigma. So it's really important to continue supporting those initiatives, and more importantly, to bring the implementation sites, which we have a rich base here in this region and in these countries based on documented successful interventions that are being done, but that remain unfortunately implemented at relatively limited scale, particularly in a number of settings. And there is an opportunity to scale those up so that we can achieve the impact that we need.
Sure. Since 2010, Vietnam has reduced the number of new HIV cases significantly. How do you evaluate this result? And what are the main challenges Vietnam is facing in the fight against HIV nowadays?
So Vietnam has achieved almost 60% or over 60% reduction of new infections since 2010, which is one of the best performance with regard to this indicator we have in this region. I think the only there is only one country who has achieved better, but when we look at the size of the epidemic and the level of the impacts that we are observing with 60% reduction, Vietnam, is extremely visible. And congratulations to the country, really good. And that's coming thanks to strong leadership, to effective implementation of response, and a lot of good pertinent, effective interventions that have led to the result that we have seen, including for reduction of mortality among people living with HIV. Interestingly, and since we started the discussion among young people, so 60% overall reduction of new infections in the country compared to 2010, but 69% reduction of new infections among young people. And that's key to highlight because Vietnam has taken up effective interventions that address the vulnerabilities of young people, and we are seeing the results. When you are managing, and not many countries have achieved this kind of situation. We see more results among the older age group than among the young people, but Vietnam, we have this. So it's really good. We congratulate Vietnam for achieving these results, and we count on continuing the progress till we achieve the common goal of ending AIDS as a public health threat. However, we do realize that when we still have about 5,700 or 5,000 plus new infections in the country, it is still not over. There is still a risk. The infections are still happening among some populations that is probably not easily accessible as those that have been reached where we have seen the impact we are talking about. We are seeing also a risk or some forms of emerging epidemics among young MSM, men who have sex with men. This is relatively emerging new trend or a combination of a persistence of the epidemic among this group. Particularly among the young key populations, as many of them tend to remain hidden and require specific models of service delivery. Let us recognize as well on the importance on use of technologies, because nowadays most key populations networking is happening virtually. So the interventions cannot be limited to site-based interventions. It's important to look at other innovations on how we can use the virtual space for finding solutions to link those individuals who are at risk to services for HIV prevention. And if they are, and testing, prevention and testing, and if they are infected or they are living with HIV, use the same models to link them up to treatment services. And the other aspect, which is the risk that comes with success, as we are coming closer to achieving high level of detection of all infections, and you have very few remaining, relatively few, it becomes very difficult to find them because those are the most hidden, mostly very recent infections. And it becomes extremely difficult to find those new infections, those remaining few new infections, which calls for innovative models of service delivery and approaches so that we can reach them. It's known, it's global. The last mile is always the most difficult. It's really important for this to use innovative approaches of service delivery, but more importantly, to have community-led responses, because the communities, they know their members, they know their risks, they know how the populations can be reached and what are their specific needs in terms of package and models of service delivery and how they should be reached. The other aspect that I would like to mention, considering all the successes has been achieved, particularly for Vietnam, it's good to start looking at the financial sustainability of the program and the response in general, and ensure to what extent this success can be sustained in terms of results, but also in terms of financing mechanism. I am aware on good work and models that are being established with regard to social contracting, solutions for funding, community-led service delivery. This is the way to go. It needs to be scaled up and scaled up rapidly so that we can continue moving forward towards achieving the goal. And I do hope that Vietnam would be one of the first countries that formally we can claim has reached the goal. And Vietnam is going very fast toward that.
I see. Is eradicate or the goal of ending HIV endemic in the region is the time is 2030, right? Do you think it is possible for Vietnam in particular, and other country in Southeast Asia in general to reach that target, to achieve that goal? It is possible.
I am a very strong believer that it can be achieved in this region in a number of countries, including Vietnam. But what it requires is to look at what it takes to achieve it. At the stage, I mean, we have achieved a lot of success, but the challenges ahead of us could be a little bit different. So we cannot continue in the same way that it has been done. And the ability to achieve that target fast or slow or when depends on how fast we will be able to adapt to the emerging needs and requirements and to the challenges that are ahead, particularly with regard to HIV response. So when I'm very positive for Vietnam, for example, on being able to achieve the goal of ending AIDS as a public health threat, even before 2030, is when I see quick policies being quickly adopted and scaled and implemented at large scale. For example, Vietnam deciding for a national scale, nationwide implementation of PrEP, pre-exposure prophylaxis. And we know that PrEP is a game changer, right? It has extremely high effectiveness in protecting against new infections, and it responds to the needs of a specific population. Now, what would lead us to the future achieving the goal is adapting and scaling up other innovations, effective interventions, effective models of service delivery, looking at specific subpopulations who might be left behind. I can give you the example of specific age categories. That's why we are attracting attention on youth 15 to 24. We can look at mother-to-child transmission. How can we prevent the infection from mothers to children? It's well codified. There is a mechanism. Treatment is available. It is achievable once there is a number of interventions and systems being put in place. You can consider on specific locations or specific populations or subcategories of populations. And the level where Vietnam has reached would require to start looking in more detail on who is left behind and why they are left behind. So if it is a matter of policy or a matter of design of service delivery or a matter of something else, including stigma and discrimination or lack of knowledge, then addressing those populations left behind with the relevant interventions that remove their inequalities and ensure that they access services, then we will be able to achieve it relatively fast. I am a strong believer, and I repeat that it can be achieved in this region, and Vietnam is very well positioned in that. While I'm being very positive, I still recognize it's still not finished. We have seen in some countries where the epidemic has returned back and has reversed. And that's why we're saying nobody is safe till everybody is safe. Same approach need to be taken. And that's why in the global AIDS strategy that has been adopted recently in 2021, there is a very strong focus on inequalities. Because when people are left behind to their own vulnerabilities and face limitations on accessing services for HIV testing, HIV prevention, and health in general, then they remain vulnerable to infections, and infections will continue, and we will not achieve the target.
Sure. Glad to hear your opinion and your prediction about the outcome or the future or the outcome of the fight against HIV in the future. It's very glad to hear, and I hope your vision will come true, especially for Vietnam. That's all I love to hear from you. And I thank you so much for your valuable time and informations. I believe with your input, my output is the report on TV will be very useful for the public to understand the current fight against HIV. And I hope young people, our audience, will find a thing or two, useful information and a way to avoid this endemic or something. Thank you so much again, and I hope you
Last comment.
yeah, I hope UNS will have some event in Vietnam or in Hanoi, so I would have a chance to interview you in person. So you are based in Bangkok, right? Or
yes, I am based in Bangkok, our regional office. We do engage with our countries. We have a country office in Vietnam. Please continue liaising with them, and whenever there is need, we would be more than happy to engage again. I just want to deliver a last message.
Sure.
Young people have the power. Young people have the solution. We need to give them the opportunities to help us implement or to lead in implementing those solutions. We have seen that the report is highlighting those solutions. They need to have the space, the trust, and the partnership, as well as the resources and opportunities so that they can implement those solutions. And I'm sure with them, we will be able to achieve that goal.
Thank you so much. That is, I will cut your answer in a small part to input it in my report. And I believe your last message is very strong and compelling for the audience to.
Absolutely. Good.
Thank
you so much. Nice talking to you.
Yes. Thanks again.
All the very best.
Yeah.